So I'm just going to talk about a cardiovascular risk and lifestyle. And why is this important? So how important is cardiovascular risk? So this is the prevalence of coronary disease in the United States. This is back in 2010. It's a little bit of an old slide. So please focus on the map and how the southern United States has so much more incidence and prevalence of coronary disease than everywhere else. Next one. This is the CDC data from 2014 to 2016, and these are heart disease death rates. So again, focus on where we live, Arkansas, Eastern Tennessee, Mississippi, Louisiana. We have the highest death rates of cardiovascular disease there in the nation. These are, of course, based on population density, but if you see up north, like, for example, New York City, with a much, much higher population density, their death rates are not nearly as high. So I guess we're going to explore a little bit about the risk factors and talk about why this is so important and so prevalent. So moreover, cardiovascular disease is not only the heart, right? So heart causes heart attacks, and that's obviously very important. It's a very important cause of death. But the cardiovascular system, it includes the arteries that go to the neck, the carotid arteries, that can cause strokes, the abdominal aorta or the aorta in general that can have aneurysms, and then of course blockages in the arteries that go to the legs, which can cause peripheral vascular disease and ultimately lead to amputation. So PAD is more prevalent and more deadly than many of the leading diseases of death right now. So focus on the right side of the table. So this is the disease prevalence in millions. So diabetes, coronary disease, PAD is number 3. And there's a lot of overlap. Cancer is trailing PAD and coronary disease. Heart failure, stroke, and Alzheimer's disease. The 5-year mortality rate on the left of the screen, PAD is 30%. So only topped by colorectal cancer in the US. Go on. If you considered peripheral arterial disease is really just a generic name for blockages in the arteries that are not in the heart. So PAD is just a generic diagnosis. If we take that a step further and talk about critical limb ischemia is when somebody is facing the risk of amputation of one of the limbs, usually the legs. So that's what we consider critical limb ischemia. Interesting, the presentation for CLI is it's interesting because 50% of the people that have peripheral vascular disease will not have any initial symptoms, and the reason for it is because a lot of them are diabetics, and diabetics don't have sensation sometimes in the feet, and they don't feel that it hurts. So 50% of people will present initially as critical limb ischemia. So again, focus to the left of the screen. The 5-year mortality for PAD and critical limb ischemia is 61%, which is more than anything else on the board. So peripheral vascular disease and cardiovascular disease is very, very important. It's a leading cause of death in the US if you put them together, more than any of the cancers put together. So how does this happen? How do the arteries block? So the initial stages of atherosclerosis is an injury to the vessel wall. This injury is not from trauma, it's not from hitting it. The injury occurs from inflammatory cells that are hanging in the bloodstream. These inflammatory cells adhere to the vessel wall and make that vessel wall more prone to capture cholesterol. So this bad cholesterol, the LDL cholesterol that you measure every time you go to the doctor, that LDL cholesterol needs to get oxidized. It gets oxidized by risk factors. Diabetics oxidize their LDL cholesterol. Smokers oxidize their LDL cholesterol. This cholesterol is more prone to be adhered and attached to the vessel walls, causing blockages. So when you hear that something has antioxidants, generally speaking, is good. It's not going to prevent you from having atherosclerosis altogether, but it's not a bad thing to have around, which is why fruits and vegetables are good for you, because they have antioxidants. Okay. Eventually, that plaque starts building, usually in the same area. We believe that there's something called shear stress. So it depends on the shape and the direction of the vessel. It was going to tend to have plaque deposition, and more likely in one of the walls than the others. This plaque is going to build, it's going to build, and it's going to build, and it's going to have different areas. The center of the plaque is going to be fat, mostly fat. And then what we call the shoulder, which is this, that's collagen and fibrous tissue. So collagen is good, fat is bad. Pretty easy. When you have a very thin cap, that plaque is more likely to rupture. If you have a plaque rupture, it can lead to a heart attack or a stroke or an acute vascular event anywhere in your body. So how do we make this plaque more stable? Well, once the plaque is there, the truth of the matter is we cannot make it go away unless you scrape it out. You can make it more stable by taking your cholesterol medicines like statin, simvastatin, atorvastatin, rosuvastatin. All these statins will make this plaque more stable, less likely to rupture, less likely to cause an event. So what are the risk factors for cardiovascular disease? Well, diabetes is number one, hypertension, hyperlipidemia, smoking, family history. So it varies. And I'll give an example. All these have equal importance as far as heart disease. Now, some of the illnesses that we deal with peripheral vascular disease, we call it aortoiliac disease, which is when you have blockage of the aorta and the iliac arteries, which are low in the pelvis. Almost never you will see somebody with aortoiliac disease that does not smoke. That's a smoker's disease. Same thing with the carotid arteries. Very prevalent in smokers. Very hard to see this in somebody who doesn't smoke. Diabetics are going to have a different presentation. They're going to have a fiction of the arteries below the knee. So we kind of look for different things, and every one of these populations will have risk in one of the or the other vascular beds or all of them. So how do you prevent this? How do you treat this? All these causes almost are preventable, except for family history. You can't choose your family, unfortunately. Smoking is preventable. Hyperlipidemia, plus or minus. If it's familiar, you have to take a medicine. But if you take a medicine, it's treatable. Diabetes and hypertension are very, very linked to weight, to obesity. And the reason for it is diabetes type 2 is a insulin-resistant state. So if you have trained muscle, if you exercise, if your muscles are trained, those muscles do not need insulin to bring the sugar in. Your heart does not need insulin to bring the sugar in. Your brain doesn't either. The rest of the tissues do. Fat tissue is resistant to insulin, which is why the higher your body fat mass, the more likely you're going to be diabetic or your diabetes being out of control. So this is just a random number. Ideal body weight or BMI is 25. That's just a number. You could be highly muscular and have a BMI that is higher than that, but that's on a case-by-case basis. Generally speaking, this is what we shoot for. Go ahead. So what is a healthy lifestyle? So let's start with exercise. What are the benefits of exercise? Well, it increases your metabolism. So as you age, it's going to be normal for your metabolism to decrease. If you eat the same amount of food and the same type of food, you're going to tend to gain more weight as you age because your metabolism is slower. If you exercise, you're going to keep this up. Weight loss, improved vasodilatation, which is why cardiovascular exercise is good for the heart and the vascular system in general. Improved activity level, and of course is a natural antidepressant, and heart rate variability as well as quality of life. Okay. How much exercise? What's recommended? So what the American Heart Association says is that at least 30 minutes of moderate intensity exercise 5 days a week. Very few people do this because it takes time and effort, which is why we have the problem that we have. But that's how much exercise you should be doing. 25 minutes of vigorous aerobic activity 3 days a week. Moderate to high intensity muscle strengthening activity 2 days a week. So all of the types of exercise are important when you run or do bicycle or elliptical, which is what people call cardio. That increases your vasodilatation, increases your heart rate, is good for weight loss. But when you do muscle training, that makes your muscle trained, which makes it less likely for your diabetes to be out of control. The muscle will get that sugar into the muscle, trap it there and use it, as opposed to somebody who doesn't exercise. Okay. So these are more or less something for you to have an idea of how many calories you're going to burn based on how much exercise you do. So let's focus on jogging. So if you weigh 200 pounds and you jog 7 miles an hour, 7 miles an hour for about an hour, this is a numbers, about an hour, you're going to burn about 1,200 calories. So keep this number in mind. So sometimes patients tell me, well, I walk around. So if you walk around the block, how much calories are you burning? Well, this guy ran 7 miles an hour for an hour and burned 1,200 calories. If I went right now to the Cheesecake Factory and had a slice of cheesecake, that has about 2,000 calories. So 1,800. Let's make it an even 2,000 with a glass of milk. It takes me about 8 minutes to eat it if nobody's talking to me, but it takes me an hour to burn it. So that's something to consider. Foods these days, or meals, are packed with calories, packed with carbohydrates that are bad for you, which is why it's so easy to gain weight. Is exercise enough? Well, the answer was that previous slide. No, it's not. You can run for an hour as fast as you can, and you can make that all go to the trash if you eat a slice of cheesecake or have a bad meal choice that day. So what is a healthy diet? So let's focus on really what the problem is what carbs it. How many carbohydrates should you eat? So that's a good question. So there's good carbs and bad carbs, but they're all carbs. If I give you $20 and I ask you to give me $20 back, I mean, $20 is $20. If you eat a slice of wheat bread, that's a good carb because you have more time to burn it. So if you eat it tonight, you still have those calories to burn tomorrow morning. So what's a bad carb? Let's put the example of a soda. Most sodas right now are sweetened with high fructose corn syrup. If you drink a soda while running on the treadmill, and this is not an exaggeration, if you drink a soda while running on a treadmill, your body doesn't have enough time to burn those calories. They go and turn straight into fat. That's how bad sodas are. They're equivalent to about 10 tablespoons of sugar. But it's not so much the sugar equivalent, but how quickly it gets metabolized into fat. So everything else is in between. Chocolate cake, cheesecake, bad carb. Pasta, not too bad. But still, if you eat 2,000 calories worth of pasta, you still have to burn them or they turn into fat.